Happy Thursday, happy Thursday, happy Thursday. How are you? Welcome, welcome, welcome. I am Dr. Triffy, and you are listening to Transforming Trauma with Dr. Triffy. Every Thursday, I show up as best as I can to teach strategies to help us think better so we can feel better and do better. My hope is that in learning these strategies and techniques, you will find ways to transform your traumatic experiences into passion and purpose and power. Tonight, I'm talking about a very important subject. We use the word in local language when we're talking about people, when we might be talking about people's moods, maybe when we're talking about a certain kind of person. I hear people saying a lot, oh, this person is acting bipolar with me. Um, but I want to talk about bipolar disorder tonight. And I hope that by the end of the evening, you know if you need some support, if your child needs some support, if somebody you love needs support. I titled tonight's session, What Bipolar Disorder Looks Like. It looks like me, and it looks like you. You couldn't tell if I was suffering from bipolar disorder. Could you? I don't, but. I don't, but. What is bipolar disorder? So I'm going to read you a definition. Again, your task is to listen and see if you can see somebody in these symptoms. That way you know what to do for yourself or for your loved ones, okay? So bipolar 1, there are two types of bipolar disorder. There's 1 and there's 2. So bipolar 1 disorder used to be called manic depression. So our parents perhaps know it as manic depression. And it's a mental illness where a person experiences drastic mood swings, mood shifts, changes in their energy, changes in their ability to concentrate, to focus, their activity levels, how energized they feel as far as getting up to do tasks or continuing with tasks, normal tasks. So we're talking about schoolwork, we're talking about your regular work life. And patients go through two very distinct phases. So these two phases in bipolar 1 must be present. There must be a depressive phase and there must be a manic phase. It's called mania. During the manic phase, the person is going to have high moods. It's called expansive. You know, I can do anything. They get lots of ideas. They feel very creative. They come up with business ideas. They come up with plans for the family, travel plans. Very energized, elevated mood. However, in those periods, because they're so high, think of it as a high, because they're so high, it's hard to concentrate and focus. Yeah. Now, during the depressive phase, patients experience what looks like depression, sad mood, crying for what seems like no reason, or ruminating on past events and just thinking about it to the point where they're just very sad, very low. Some people develop a sense of hopelessness. They're just going to a very dark place. So think about that. As a person, there you are, you're going through what seems to be sadness and other periods where you think like, oh, I'm great, I'm okay. How easy would it be for you to realize you might be suffering from a mental health condition that could actually get better? A lot of people experience the symptoms, but they think that's just who I am, that's just my personality. Well, it might not be just your personality, and it might need medical care, okay? Bipolar 2 is another form of bipolarity where you only have the manic phase, the up phase, the high phase. But that high phase is a difference in the number of days that phase must last before we distinguish it between bipolar 1 and bipolar 2. So for bipolar 2, you need to be in that high mood for at least 4 days, for 4 days or less. But for bipolar 1, people experience that mania, that manic phase for at least 7 days. Okay? All right. So some symptoms to look for in your person. When they're in the manic phase, when they're high, think of it as high and low, is they're expansive. They can do everything. Mm? Very excited. They might not sleep for days on end. They might also be very irritable. The thing with bipolar disorder is, I think it can be very challenging to spot, especially for family members and people you've known forever. So people you've known forever, like your mother, your child, a sibling, it might be difficult for you to recognize that that's what's really going on. Again, you might think that's just the person's personality. Okay. What are some risk factors? How do you know, hey, I need to look out because I might be at higher risk than somebody else on the street? Okay. One is your chances for being diagnosed with bipolar 1 disorder. Remember, that's the one with the uh, manic phase, depressive phase, and the mania lasts for at least 7 days. It increases tenfold if there's a family history of bipolar disorder. You're 10 times more likely to be diagnosed with bipolar if you have a family member. Okay? And your chances will increase even higher if that relationship is close, like your father, your mother, a twin, a sister, a brother, grandparents. Okay? So, because a lot of you live in Dominica and in the Caribbean, I know we didn't grow up in a system where many of our elders got diagnosed with a mental health disorder. That does not mean they were not suffering from a mental health disorder. So, how can you think about it? What can you think about? What are some signs you can think about when you're kind of looking back at your relatives to see, hey, might I have been at risk? Some of those symptoms I'm going to talk even more clearly about. Okay? All right. So, here are some symptoms. In bipolar 1, a person will experience mania or hypomania. Okay? Mania or hypomania. You need 3 or more symptoms to be present for a diagnosis of mania. 3 or more of these symptoms. 1, if you know somebody or if it's you who has an inflated sense of self-esteem and grandiosity. Grandiosity is, I am high and mighty. I am better than you. Hmm? I'm better than everybody else around me. I've got it like that. I can do anything. You can't stop me. I'm the king of the world. I shook up the world. That patient usually feels unusually important. Okay. And they'll tell it to you and they'll act that way. That's one symptom. Number 2, the person may have a decreased need for sleep. Check on your people who have trouble sleeping for more than a night. And some of us, we might say, oh, I'm just having trouble sleeping. Or, yeah, I suffer from insomnia. Yeah. Okay. They have a decreased need for sleep and they tell you they still feel rested or they still have energy to do more. That is unusual, right? Another symptom is they are more talkative than usual. They're talking your head off. You're trying to go do your chores and they're in a conversation with you, they won't let you go. Sometimes their speech might even feel or sound confused, like their words are falling over each other. Yeah, they're talking so much. It's called pressured speech. Okay. They might have what's called a flight of ideas. They might even tell you, man, my thoughts just feel like they're coming real fast, rapid, like, I just can't stop thinking. Some people actually tell you, my thoughts feel like they're racing. Okay, racing thoughts. Another symptom is they're easily distracted. Easily distracted. It's hard for them to focus on one task to complete it. Easily distracted. I'm thinking of one person who, within the span of 1 year, said, I want to move to Puerto Rico to learn Spanish. And no, I think I'm going to move to Virginia to go to work. And this person actually quit a job they had been working for over 8 years. And yeah, they just had to do it. They just had to do it. These big plans, very big plans, life changing plans, right? That don't always seem to be very well thought out. Okay. And during a manic episode, a person might also engage themselves in activities that are high stakes, like just when I say high stakes, something like they might start a new business. They might decide to quit their job where they had their 401k and their retirement plan. Yeah, they might decide to run away with a new person. They might spend a huge amount of money without telling their spouse, risky sexual activity. So, a word we use is called hypersexuality. Many people who suffer from bipolar disorder, one of the classic symptoms is sleeping around without much thought about it, sometimes without much care for their protection. Hmm? Making huge investments. Money is often involved. It's like, you know how money makes us feel powerful. And when a person is in that state of like, I can do anything, I have this fantastic idea. Come on now, I want to do this. Yeah. Don't hold me back. Yeah. You never listen to me. I know what I want to do. This is it. Yeah. People can go on big shopping sprees with money that is supposed to be saved for the family or for something else they might have been saving the money for. So mania lasts, it's got to hit at least 7 days of that manic state being present in the person. Okay. Hypomania, think of hypo. Hypo is right, like the you can have hyper is up, hypo is down. So hypomania is 4 days or less of that feeling of I can do anything. I, I'm in love. I'm going to buy this. I'm going to change my job. I'm tired of this. This is not working. The thing about it is, in real life, people are not always so clear cut. Okay. So you might just hear your person jumping around in big ideas. In big ideas. It's not as if they'll do it for 5 days and stop. It's not that clear cut. So that's where some of the challenge, I think, comes in noticing if something is out of the ordinary with your person. Plus, if you grew up with a person or if you raised a child, yeah, you might just think that that's how my child is versus this is not usual or it's out of the ordinary and I need to go get some help for the child. So you need 3 or more of these symptoms that I just listed for them to be present for at least 7 days. Again, a lot of us, we're not necessarily paying such close attention to the people around us in our homes or children or spouses. Yeah. So you might not notice something is a little off until maybe 2 weeks. Okay. But for at least 7 days, if those symptoms are present, it can be diagnosed as mania, which is the high part of the bipolarity, right? Bi is 2, polar means, yeah, like opposite. Okay. Remember, if these symptoms last for 4 days, yeah, consecutively, then it's a hypomanic episode. So in both mania, which is 7 days at least, and hypomania, 4 days, the symptoms cannot be related to any other illness. There are some other illnesses that look like bipolar disorder. Okay, for example, there's something called schizoaffective disorder. You have schizophrenia. Yeah, you have depression, which is the one side. Yeah, and sometimes you might have a medical condition. Okay, where you're having similar symptoms. So those other illnesses do not have to be present. Okay, and then you can say, okay, this might be what is going on here. All right. Now, Anything has a level of severity to it, so the episode might be mild, where you might see the person being mildly irritable, distractible, mm, but it could be severe. And some of the symptoms right here are really severe. If you have a spouse and you all are saving up money to buy a house, and your spouse is experiencing a manic episode, goes into the bank account, takes off all the money, that happens, y'all, takes off all the money because they have this big idea right now to start a business, or they want to buy this, motorcycle right now. That can, of course, cause so much distress in families, in relationships, in the person's life themselves. Once the episode has subsided and they come back into balance and they realize what they did. Hmm? So remember that the other side of the manic phase is the depressed phase. And for that depression, what you want to look for are these symptoms. One, loss of interest in things the person used to find pleasurable or fun. Mm? Say they enjoy going to the movies or they enjoy talking to their friends, but now they're just in the room watching Netflix 2 days in a row, 3 days in a row. Yeah. Increased periods of sleep. So you can also have it the other way, where the person is having difficulty sleeping. But in think of depression. Depression, we're going lower. So a lot of people will sleep more because they also feel more fatigued, like just heavy. Yeah, like it's hard to get up out of the bed. You feel like you're dragging. Okay? Crying for no reason. If you're crying for no reason, nobody died in the family, you didn't have a big argument with your spouse, your kids, and you're just teary, just crying for what you think is no reason, or the people around you think is no reason. Hmm? Trouble concentrating. Your concentration problems are a big sign of mental health challenges. It's one of those symptoms that's in ADHD, which is attention deficit. Yeah, it's in bipolarity. Yeah, it's in the manic phase of bipolar disorder. It's also in depression. It's also in anxiety. So your ability to focus and concentrate is a powerful signal of your wellness. So if that is compromised, you want to start looking at other things as well. Okay. Also, in that depressed state, a person might have feelings of hopelessness. I'm so tired of this. Oh, this is never going to get better. Why can I never get things done? Why did I spend so much money last week? Yeah, when they were in that manic phase. Why did I leave my job? Why did I break off my relationship? Okay. And the lowest of the low is when a person starts telling you, I'm tired. I don't want to do this anymore. This is too much work. I'm exhausted with life. Some people actually make attempts and some people actually succeed. Okay. So do you see how, if you're that person swinging from this high, like say last week, you were feeling full of energy. You wrote out a business plan. You actually went to the bank, got you're in the loan, whatever process. And next week, you're down in the dumps thinking, why did I do this? This is a waste of time. I hate my life. Yeah. So it's very, very, very destabilizing and disabling. So bipolar disorder, because of the symptoms, is one of those mental health challenges that is most impactful when it comes to disability. Yeah. People having to take time off from work and sometimes just not being able to work at all, especially if these symptoms get piled on to the mania and the depression. These symptoms I'm talking about are psychotic symptoms. Okay. What are psychotic symptoms? So if a person is psychotic, think of a person that you've seen as a person who seems to be out of touch with reality, like they're not there. They're talking what you think is nonsense, right? The stuff they're saying does not seem to be making sense. Okay, so let's talk about bipolar psychosis, because you can have bipolar disorder with psychotic symptoms. Can you believe it? On top of depression, on top of the manic activity, you have psychosis. Some symptoms include delusions. What is a delusion? A delusion is believing something that is not real, but you cannot argue with a person who is convinced of what it is they're telling you. Okay? Or that person might have hallucinations. What's a hallucination? A hallucination is hearing something that is really that you're the only person hearing it. So if you ask your mom, did you hear them call my name? Or didn't you just call my name? Well, sometimes people do this, right? Like sometimes you might think you hear something, but I'm talking about, I heard a truck run through. Yeah, I heard a dog barking, and yes, the dog is right here. It's barking. Don't you even see it? Some people have visual hallucinations. Some people have tactile, where they feel like spiders are crawling up their skin, or they feel like somebody put a pin in their body, mm, or they're tasting weird tastes, or they're smelling things that you say, no, I don't know. I'm not smelling what it is you're telling me you're smelling. So these are very intrusive symptoms. That's going to totally, do you think you can hold a job down in a steady way? If this is happening, you're on your job and you're telling your supervisor, I'm seeing this, and they're telling you no, they're not seeing it, or you're hearing something. Yeah. And the way that we deal with mental health challenges and things that seem unusual is not very helpful for the most part, is it? Yeah. We have such a stigma towards mental health challenges, brain health challenges, because that's really just a brain disorder. Okay. We have such stigma that it's hard for people to tell us, and it's hard for us to tell people when we might be experiencing symptoms that we know, that's kind of, they might think I'm a little weird or different. Okay. So a delusion is a false belief that a particular person thinks is true. Hmm? It used to be called paranoid disorder. Okay. You might have a bizarre delusion. A bizarre delusion is something very weird, right? Like just outside of the realm of possibility. A bizarre delusion is like me telling you I'm Cleopatra, Queen of the Nile. Yeah. And for me to really believe it. And for me to really believe it to the point where I might get mad at you for telling me I'm not Cleopatra. Okay. I might think that I work with the FBI. I'm an investigator with the FBI, and there's no evidence of that. Yeah. But I'm firmly believing, yeah, I'm an FBI agent. You know, I've had clients tell me before that they're black belt in karate. They've never done any karate in their life. Yeah. But it's a fixed belief. Okay. But it's a false fixed belief. You might have some people telling you, some people with delusions that are called non-bizarre, meaning it's not a strange thing. That one catches a lot of us family members. Say, for example, you have a husband or a wife who tells you something like, I don't want to eat that food. Meat over there, meat makes my stomach hurt. How would you know if that's real or not? A lot of people have these delusions. or they tell you, nah, this is not good for me. I'm not touching that. This is gonna kill me right here. This gives me stomach pain. No, this is evil food. Stuff like that. Okay. There's no way you would know. Yeah, it's not out of the realm of possibility that that meat might just be terribly hurting their stomachs. Yeah. Some people, back to some, here's another bizarre delusion. If you have people who are telling you that they were abducted by aliens. Now, I know a lot of us think that that's true, but if you come to me and you tell me an alien abducted you, my first thought is not going to be, yes, that you were really abducted by an alien. Okay? All right. So these psychotic delusions, remember, psychotic only means it's not real, like it's false. Okay? There's no evidence for it. So there's some categories of these delusions. One is called erotomania. Erotomania is about eros. Eros is about love, right? Love in a romantic sense. So there are many people who believe that you're in love with them or they're in love with you. Somebody important loves them. You see how there are some people who will track a big celebrity and stalk a celebrity, thinking that the celebrity is either married to them or loves them, like that. Okay. Then you have grandiosity. Grandiosity is those people who think, I'm so special. I'm more special than you. There are some people who actually think, again, like they're Cleopatra, or they are some very special, special, special person, or they have a very special relationship with God. Very, very special relationship with God that you in your loneliness cannot hit. Okay. Some people have a delusion of jealousy where they think very often that their partner is cheating on them. Hmm? And they become so fixed in that belief, with or without actual evidence, that they'll do many things. You know, they'll say many things to their spouse or their partner that's very painful, very, very, very painful, and causes breakups. Yeah, causes divorce. I've given the example before of spouses who record their significant other, or they follow them. They put tracking devices on their spouses because they strongly believe, without evidence. Okay. Now, many people cheat. That's not what I'm talking about. And many a spouse has been found out. But I'm talking about these people who are sure that their spouse is cheating, but there's no evidence for it. And they say and do many things that hurt the spouse. Okay. Then you have people who have a delusion of persecution. What's it? Persecution is somebody is out to get me. That person right there, they do not like me. That boss has it in for me. Meanwhile, that same boss is talking to everybody else the same way they're talking to that person. Hmm? Yeah. That person right here, they don't love me. And you, being that other person, might be doing everything in your power to prove your love to that person. Yeah. And then you have those somatic delusions. That is, somatic is body. Some people who believe that they're sick. There's nothing in any EKG, there's nothing on any MRI, but they're convinced that they're sick or that they have an ailment and that they're literally dying. Okay? Yeah. So I want you all to look out for something. Sleep and your ability to focus. If you're having trouble sleeping, this is an aside, right? And I want to say it before I move on. If you're having trouble sleeping, if your spouse, if your child, your parent is having trouble sleeping often, please go to the doctor, because sleep deprivation and trouble sleeping is another one of those symptoms that shows up a lot with a lot of disorders. Okay? All right. Okay. Now, we talked about those auditory hallucinations. We talked about olfactory is your smell, you have visual, they're seeing things that are not there, and they're feeling things that are not there. Okay? They're also tasting things that are not there. What causes that? How does that start? You give birth to a beautiful little baby, child grows up. What is that about? So the causes of bipolarity and bipolar psychosis, not really known, but there are some factors to look out for. There are some factors to look out for. And type in the chat if you remember one of them that I said. I talked about a huge risk factor. Type in the chat what is one of the biggest risk factors of bipolarity. Okay? All right. I'll tell you some more. Hormones in the body. So psychosis may be influenced by hormonal shifts like changes in the body that happen around puberty. There's some changes that happen in the brain too with people who suffer from Alzheimer's and Parkinson's disease. Following childbirth, you're at higher risk for developing psychosis. New mothers, about postpartum depression. Sometimes that can come with psychosis. Okay. Here's a big one that a lot of people don't want to hear. The people who like the the puffers, the people who like kaya and ganja, weed. So marijuana, there is some research, people who like the herb. Some research suggests that people with bipolar disorder who use marijuana have a greater risk of developing psychosis. So remember, y'all, it's bad enough to go from being low and depressed to manic, which is I can do anything, and people make very poor choices often in that state because again, there's a sense of invincibility, and grandiosity. And on top of that, you have psychosis, where you're hearing the voices and you lose touch with reality. The research is showing that smoking marijuana does not help if you already have bipolar disorder. Okay? Next one, stress and trauma. There might be nothing in the world as illness inducing as stress and trauma. So what do you do? What you've got to do is limit as best as you can your exposure to stress. But as a child, especially, do you think kids, as parents, you're not with your children 24/7. So you're going to miss a lot of things that happen to your children. Children go to school, you leave them with babysitters, you just never know who's the other person that is interacting with the child. Children who've experienced stress and trauma, high stress and trauma, are at higher risk of developing psychosis and developing any mental health challenge. Anyone. Okay? Sleep deprivation. If you're not getting enough sleep, lack of sleep and sleep deprivation plays a role in triggering the onset of psychosis. Okay? And what is that psychosis again? It's a psychotic break. It's where you see people talking to themselves. Yeah, they're acting like they're having a full conversation with other people. Or, as I described earlier, they're telling you things that leave you asking, are you sure? But again, because we're talking about family members and people we love, it can be very hard to admit that your person is struggling. I'm asking you to please, if you feel uncomfortable, if you feel any weird vibes and you're like, man, am I sure? Are you okay? It's not going to hurt to take your loved one for an evaluation, to talk to somebody else. Okay? All right. If you have a child And I'm starting with children because, I think they're the most vulnerable. And if we can catch these symptoms early, then we can get help early. We can nip a lot of things in the bud. Okay. So some early warning signs of psychosis are the following. If you have a child who seems to be highly anxious, constantly worrying about, say, their grades, like very, very anxious, very worried about their performance. Yeah? If you have someone who's experiencing strong feelings that don't seem to be appropriate, like it doesn't match, the feelings that they're demonstrating don't match the circumstances, the situation. Okay, so you have a child who becomes say they're disappointed, child, a person, whatever, young person, they're disappointed, something didn't go their way exactly. You have some people who, in local language, I mean, they might flip. Yeah, yeah. The feeling is so out of proportion for what is really happening. Okay, you might have a person, this one is a big one. If your person starts not taking care of their physical hygiene, they stop bathing. You notice it's been 2 days, they haven't taken a bath, they're kind of slower. If they have to shave, they're not shaving, they're not doing their hair. That's another big sign. So I gave you 3 big signs, y'all. In your real lives, look for this. You have somebody in your life who stopped taking a shower. Okay? Most people take a shower once a day. 2 days, you might have what we call in Dominica a quas build-up day, where you're like, man, I don't want to do anything. Yeah. 3 days. Yeah. Yeah. Let's talk. Okay. Sleep is the other one. Yeah. And concentration, ability to focus and concentrate. Okay. If you have somebody becoming overly suspicious of other people, they go to school, they're telling you, oh, this teacher doesn't like me, that teacher doesn't like me. You might have one teacher, that's not getting along with a child for whatever reason, but all the teachers in the school, you know, everybody, all your friends on the bus, they don't like you. What is going on? Yeah. You have adults at work. Yeah, everybody's talking about me. When I pass by there, I see them laughing. I'm sure they're laughing about me. That's that mistrust that often comes with paranoia. Hmm? Struggling to concentrate. Concentration. You're sitting in front of your computer, right? You got to send off a little email. It's taking you 30 minutes. Something's wrong. You have a paper to write that used to take you, in an hour, you're done. And 2 days, 3 days, your energy is low, you can't focus, something is going on. It might not be bipolar disorder, but something is probably going on. Yeah. Here's another big one: withdrawing from friends and family. So I just had a young man a couple weeks ago at school, and family says that his friends are worried about him because he's not interacting with them the way he used to at the beginning of the semester. So this young man was actually in a state of developing psychosis. He has a history of bipolar disorder, and the psychotic symptoms were flaring up. Yeah, he had just made a transition to the school, and it was very tough. So you see the stress. The stress was a trigger, feeling isolated. So he started engaging with the kids, with his peers, normally in the beginning, and then just started getting lower and lower and lower and started removing himself from them. Okay. So that's a big sign, that withdrawal from people, from friends, from family, and from things, say, that person used to do before, okay, that they used to find enjoyable. All right, y'all. So with psychosis, With people who are in very deep psychosis, say with schizophrenia, you'll see many people homeless on the street, engaging with themselves. A person can become so psychotic that they become incoherent. What they're saying is just not making sense. Okay? It's not logical. It's not logical. And when that happens, of course, people are not, I mean, they don't even know how extreme their behavior is. Okay? Until they get better again. So again, some of those hallucinations might match the person's mood. Sometimes it doesn't. Sometimes you might see a person laughing for no reason, or for something that's supposed to hurt, they're laughing about it. Okay, it doesn't make sense. Their mood does not match the hallucination they're having or the delusion that they're having. There's some people who have what are called command hallucinations, where people are telling them to hurt themselves or to hurt other people. Please don't discard what somebody's saying, right? Or dismiss what somebody's saying if they're telling you, I just had that thought. Is that's a big, big, big sign that your person needs some support that you cannot give. And just talking about some of these symptoms, that's not enough. That's not enough. Okay? If it gets to that point, your person needs hospitalization. All right? So how do we treat it? Again, if it's at that level, if it's unmanaged, there are many people who, of course, before you get a diagnosis, you're walking around and you don't even know what's happening. Like I said, some days you're low, some days you're high. You just think you just have a bad attitude. Yeah. But when you get diagnosed, you can be treated. And a lot of people have typical lives when their symptoms are managed. So, how do you treat these symptoms? This is a brain disorder. This brain is not your willpower. You're not being bad. You're not mean. You're not whatever, right? If that's what your diagnosis ends up being once you go to a professional, then number one, medication. Number one, medication. I'm talking to my people because I say it often. It took me a long time before I became okay with the idea of psychotropic medication. Took me a long time, because I grew up in a culture where there's a bush tea for everything. And I could go by my hotel in the village to have her rub me if I wasn't feeling well. Or they would give me a shove, a drink, a concoction of something. But this is a brain-based disorder. So you go to a health professional. Okay, you go to a psychiatrist because that's a medical doctor who can prescribe medication to help the person manage these symptoms. You go to a nurse practitioner, right, who might be under the supervision of a medical doctor. You go to there's some psychologists who are prescribing psychologists depending on where the person is. That's where you start. Medication support. If a person is telling you they're hearing voices, they're seeing things, they don't trust you, you're their mother, you're their friend, they don't trust you anymore, we need some medication intervention, more likely than not. So, whatever fears you have about that, I am here to tell you that there are so many people who look like me, who look like you, who have a diagnosis of bipolar disorder, who are living regular lives because they have found appropriate medication to regulate these mood swings, this drop and this elevation that keeps people it runs a person ragged. Again, imagine if this week I'm feeling down and out, and next week I think I can rule the world. And then next week I fall again. I'm going to start thinking probably that I'm lazy or I just don't have it in me. when all I might need is some medication. Okay? Other people might need medication plus therapy. For the most part, my recommendation is both. Most people do better on both. Okay? On both. There are lots of medications to manage depression. There are many antidepressants. You'll get something for that. You might get something to manage the mania. There's some medications that do both. There are some medications that help with the sleep part, and there are medications to help with the psychosis part. Okay, y'all? There is no need to suffer without hope anymore in 2023. I just don't, I'm not big on the suffering just to say I'm strong bit in 2023. Why? Because there's no need for it. There's no need for it. You don't have to prove that you're strong. You don't have to prove that you are the holiest one and that your prayer is going to wipe it away. I'm really very sorry to tell you your prayer is not going to wipe bipolar disorder away. Somebody might tell me, well, my pastor prayed and it went away. Well, maybe you are 1 out of 100. So if I'm going to take a bet, right, I'm not going to say, okay, you'll be that 1 out of the 100. And there are many parents from our culture who in the end say your loved one ends up suffering because you're either afraid. Yeah, you're either afraid. A lot of us, we have a lot of fears. We think, well, my person will become addicted to the medication or they'll become like a zombie. You know, the thing is, back in the day, before the medications became much better as they are right now, they were really tough. I mean, you did see people who were just, they'd be not looking good. So I think some of the pictures we have in our mind about medications to help ourselves and our families regulate themselves to the point where they can go back to work and back to school and succeed in their marriages. Can you not see how suffering from bipolar disorder can tear down a relationship? Can be so hard on kids. If you have a parent in a home in a state of mania who is taking all of the money of the family to go do something because, this is what their mind is telling them to do today, who suffers? The family suffers. You have arguments. People with bipolar disorder have a lot of interpersonal challenges because of that irritability and that feeling like I'm the boss. I'm in control of everything around me. Yeah, I'm the boss of all I survey. People better step up and do what I want them to do, or else they don't like me, or else I don't like them. Yeah, lots of verbal back and forth, lots of physical back and forth. A lot of substance use because before people get diagnosed, a lot of people are just trying to feel better. They're just trying to stabilize themselves between that up and that low low. Yeah. I am trying to say that you do not have to suffer like that. You don't have to suffer like that. I want to tell you that so many times that I want you to think about a brain challenge like that, the way you think about diabetes, or the way you think about hypertension, or the way you think about cancer. You're not going to just, well, a few people, again, that's a very low percentage. Maybe 5% of people will say, no, I want zero medical intervention if they get a cancer diagnosis. I'm just going to pray about it. A very low percentage will do that. I can see how, some people do that. But I don't know that the success rate of doing it like that is high. So I do feel like it's my mission it's part of my mission, yeah, to help you understand that you and your family do not need to suffer relentlessly You don't have to suffer relentlessly. There's a lot of new medication to help manage these illnesses and this illness in particular. Okay. Just saying the word bipolar disorder, again, a lot of people throw it at you like, you bipolar, like as if that's a horrible thing. So I understand that there's stigma attached to it, like Karen is saying, you know, but this is 2023. We come from a history of a lot of pain. And I do believe many of us look at it as a badge of honor to say, I'm tough, I'm strong. That didn't shake me. That can't touch me. Ah, look at me. But there are many people on the other side here, they're not doing it in that kind of hard way. And they're succeeding in their lives. While if you are struggling with this bipolarity plus psychosis that you cannot control, how can you succeed? How can you do the best you're supposed to be doing compared to the person over there who's getting support? The thing is, you deserve the support too. You deserve the help too. You deserve the help as well. Okay? So, what are some things that you can do yourself? Yeah. One thing you can think about doing is journaling. So, as a therapist, I might encourage someone who is struggling. Here's the thing. Number one, many people, when they get that diagnosis, it's like a big adjustment because, again, there's a lot of stigma attached to a big word like that, right? Bipolar disorder. What does that mean? Plus, if you pack on top of it that the person's also experiencing paranoia, hallucinations, delusions. Yeah. So in the beginning, it's almost like a reassessment of your identity. Who am I? What does that mean if I have bipolar disorder? Am I crazy? What's wrong with me? Will I ever be able to work again? Will I succeed in life? Is my life over with? So therapy, psychotherapy is very, very important, especially in the beginning. And for bipolar disorder, I personally recommend having a therapist who is your therapist. And just with the expectation that for the rest of my life, I will check in with someone. Even if it's once a month after the person has attained stabilization. So, stabilization is when, for some people, you've got to go to the hospital and stay there for a little while the medical professionals work out the best dosage of medication, the best medication itself, because there are different medications that do the same thing. They're meant to do the same thing, but because we are different bodies, every body is different. It might have to be a different one. Yeah, so they might have to play around a little bit, give you some time for the medication to make its way through your body. If you're taller, it might take a little time. If you're a little bit, it might take less time, whatever, right? Your chemistry might be different. And so the medication will work with everybody in a different way. But you need to get that stabilization. This is just, I'm asking you to look at it as diabetes or hypertension, or like my child has asthma, okay? My child has asthma, and every now and then my child has a flare up, okay? Depression or bipolarity, okay? And that's how you look at it to deal with it. We don't choose these things. You don't choose that you're going to be biologically predisposed to manic depression, right? You don't choose that. This is biology. And so you must look at it as biology as opposed to, oh my God, somebody did something to my child. Oh my God, I'm getting punished. No, you didn't do anything. And your child didn't do anything. Okay? It's just like your child has asthma. When the child has asthma and there's a flare up, we're going to go to the hospital to get stabilized. Once we get stabilized, we come home We connect our child or our loved one to a community therapist, somebody they can go to once a week. Hmm? And a psychiatrist, somebody who is going to regularly, every 30 days, give them their medication, check on them to see how they're doing. Hmm? Check their blood, check their vitals to see, hey, is everything going okay? Is this medication working? Is it not? Do we need to increase it? Do we need to decrease it? And it's going to have to be a way of life, because your brain chemistry is your brain chemistry, right? My blood type is whatever my blood type is. That's it. So, for the most part, with a diagnosis of bipolar disorder, you just manage it regularly, medically, and with therapy, or with things like I was saying, journaling, de stressing activities, learning activities that soothe you, so that when you're feeling out of sorts, because you have to imagine it's like, okay, so you have the depressed state before you come back up, because people go all the way up to the manic, so you're going up to the top of the pole. That's a lot of emotional energy and a lot of emotional changing, right? Sometimes it's rapid. Some people drop very fast, some people it takes them a little time, or they go up very fast. Everybody's different. So it's a lot of internal energetic shifting and changing. So we as the family, we do the best we can to support our loved ones, ease up, learn them. They teach us what helps them feel better. That's how we support each other. But my biggest thing for you tonight, before I speak with our guest, who will tell us more about bipolar disorder, how she found out about it, what she's doing, how she's coping, I want you to understand that you have, with the right support, you have as good a chance as me, as you, as them, as they, to have a proper life. Okay? It's not a death sentence, and it's very manageable. Of course, it's challenging and painful, but life is challenging and painful, isn't it? Okay. So I got me a sister that I'm excited to invite. I'm going to bring her to the stage. You all ready?
Can you
Hello.
hear me?
I can hear you. I can hear you.
Okay.
I was hearing a little feedback a while ago, but y'all, this is Deacon Ramona Sam. Ramona Denard. Samuel Denard. This is Ramona, who is in Antigua right now. I'm
Yes,
so
my
excited
son.
for her. Welcome, 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 Ramona.
Thank you. Thank you.
You're so welcome. You're so welcome. Look, when I posted the announcement, I saw your response, and something you said just kind of pushed me to invite you to share your story tonight.
Thank
You ready to
you.
go? You ready to go?
Yeah, I'm ready.
Well, tell the people a little bit about you, and tell them, what is your bipolar story?
Okay, so my name is Ramona, and I am a minister of the gospel, self confessed artist, love all things creative, lover of ice cream and shoes. So if you ever want to gift me ice cream and shoes, I'm there. I was born in Dominica, and my family moved to Antigua when I was age 14. Um, I think looking back to my childhood, I always kind of felt like there was something a little bit going on, but never really had the vocabulary for it or the understanding even.
Hmm.
And you said something when you were talking earlier about the mania that people experience. And one of the things I remember happening to me in my teens, I think was more pronounced. I would just feel excited for no reason. And I would say to myself, I'm feeling excited, but nothing exciting has happened. I don't understand why I'm feeling this heightened state of excitement.
Hmm.
And so that kind of carried through my teen years and my feelings of the chaotic thoughts and all the rest of it. But I think because of my personality, I was able to mask. So I did a lot of masking. And I remember sometimes I would go home and cry
Mm.
because I'm thinking, what is wrong with me? Um, and added to that, you talk about trauma and all of that. I think all of that also probably played into some of which came first, I don't know. But I think all of that had some kind of effect on it. But
Yeah.
you go through life and you know that there's something a bit weird, but you don't have a name for it. You don't have any understanding. You just think, oh, maybe it's just me. There's something wrong with me. Whatever, whatever. So I wasn't diagnosed until 2016. 2016,
So that's
right?
recent, yeah?
Yes, yeah, 2016. Because a very good friend, my best friend from when I was from 14 when I moved to Antigua, who is like family or my adopted sister. So I'm here in my family home, adopted family home.
Hmm.
She's a doctor in Virginia, and I had been struggling for a while. In 2010, around there, I had a massive breakdown.
Okay, I was about to ask you when you say struggling, what do you mean?
Right. So you have all these thoughts, and how you talk about the chaotic thoughts, you talk about
Mhm.
the mania.
Yeah.
I should say that my diagnosis is bipolar 2 disaffective
Mhm.
disorder. So it's not the what people would see as the extreme
Yes.
ones. I don't
Yeah.
have delusions of grandeur, that kind of thing.
Hmm.
But I do experience mania,
Yes.
and then I experience the crash. So
Yes.
what I knew would happen is that whenever I felt myself feeling excited, I would always say, okay, I'm just gonna wait for the crash. And
Mm.
I didn't know then, I didn't know what was happening, but that was
Yeah.
how I would describe it. So for years I think I masked for a long time. And I would describe it now as somebody, imagine you have a broken leg and you never
Hmm.
get it attended to, and you're just walking through life limping for years and years until eventually you can no longer walk or whatever.
Yes. And
Um,
you say that friend of yours from Virginia who's a
yeah,
doctor.
in 2016, she came to my ordination
Okay.
and we had a good chat. And I finally sort of told her everything that I was experiencing
Hmm.
and what I was feeling. And because she knows me, so she
Right.
could see the different patterns. And of course, with her medical background as well, and she let me do a test. And
Yes.
she's Ramona, I think you have bipolar. So she actually got me to make an appointment with my doctor while she was here
Yes.
and came with me to the doctor. And that for me was one of the most freeing things that has ever happened to me, because for the first time I made sense. Um, and I didn't expect to cry, but I'm feeling a bit teary as I talk about it. But
Yeah.
I made sense. All
Yes.
and externally looking at me, people wouldn't really know,
Absolutely.
um, because I carried it for so long. And I
Hmm.
think at that point in 2016, I was just exhausted.
Hmm.
So I went through life. I went through college, struggled through, um,
Hmm.
never could cope with finishing assignments,
Yeah.
staying up the night before. I did my dissertation the night before it was due. I stayed up all
Wow.
night and wrote my dissertation. I
Wow.
still managed to get an A.
Yes.
um, but that was my life going to school.
Mhm.
I would always say, oh, I thrive under pressure, which
Yes.
now I know, I understand why I would say that.
Hmm.
Um, and so you talk about lack of sleep and not sleeping. So it really became heightened around 26. So after I had the major crashing around 2010 or 28, somewhere around there. And
Hmm.
um, again, it was a time when I was struggling. I knew that there was just stuff happening. And my head felt like, when you give a child is just learning to draw and crayon, you give them a crayon and they just
Yes.
write all
Like,
over the book. Yeah,
yes.
that's how I would describe what was happening in my head. So there was I see a meme when people talk about you have 20 different tabs open at once in your laptop. That
Yes.
imagine all of
That's
that happening
feeling.
inside your head, and it's
Hmm.
just constant. Like
Hmm.
your brain just won't shut up.
Yes.
So you
Was
go
it
to bed,
relentless? Was it relentless?
pretty much, pretty
Yes.
much. You go to, sometimes it was more heightened than other times,
Yes.
and you
Yes.
go to bed and you just can't sleep because you're thinking through everything that happened through the day. You,
Right.
I would say to people, I can come up with 50 ideas in the morning. Okay,
Yeah.
I can wake up in the morning and I could give you 50 amazing ideas for you to start whatever enterprise you want to start with.
Right. 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 You're the
Um,
generator of the ideas, but when it comes to sustaining it all the way
oh
to
my
the
goodness.
end,
No, yes, yes. So I can
yeah.
come up, give me something, give me a project, I can come up. But
Yes.
yeah, the sustaining, managing and maintaining of that is what I really
Hmm.
struggle with. And that's what I struggle with all through going through school.
Yeah.
Um, and there was a certain time when in my early 20s, I was
Hmm.
very, I want to say this carefully because I hate when people say that as well. I'm going
Hmm.
to say this because I can't explain it better. I would say I had OCD tendencies. So
Okay.
I
Meaning,
needed
so
to
tell us more.
do things a certain way.
Yes.
And if I put things down, say if my bedroom, for example, I
Hmm.
put it down and it has to be, if somebody came and moved something, I would know.
Yes.
And it has to be that way. This I opened the art.
What's the feeling that would come up when it was moved?
It just felt like I I can't.
A sense of anxiety?
Yeah, yeah. It's like, oh, I can't. And I know that when I was younger is when that happened. Well, into it happens sometimes now, and it's a
Mhm.
sign I know when I am going down. Is that
Yes.
I get very worked up about, like, if I'm walking, and they're like cracks on the pavement.
Hmm. Hmm.
I either have to walk over them or
Hmm.
walk on top of them,
Yeah.
right? Like step directly on it.
And that's the little bit of the OCD. So
Yes,
OCD is so it's a repetitive, intrusive thought. Yeah.
yes, yes,
That sometimes is followed with a behavior. Wait, this
yeah,
is where you have the yes,
yeah.
yes.
So I would have those things where, and I would always say I'm an extreme person.
Hmm.
I couldn't. It's like I found it difficult to find the middle ground, the balance. I
Hmm.
was either that or that. So I was
Either
either
or.
very
Yeah.
clean or
Yes.
very messy.
Yes.
Um, so I forget where I was. So so
Okay.
yeah, but let's go back. Ask me a question.
It's okay. It's okay. It's okay. So you were talking about having certain patterns, right?
Yeah.
That you had to do certain things. Perhaps it was the way that you learned to cope, or in some instances, it felt like it was. Right now, you could notice it and know that's a symptom. I'm kind of okay. I'm hyper focusing on certain things right now.
Yes.
I'm crashing.
Yes.
Yeah.
Yes. So the diagnosis 2016, and it wasn't an immediate process because you had to go see psychologists, have quite a few appointments. I had to go then with my husband at the time,
Yes.
so that he could understand what was happening,
Yes.
talk about some of the mania that I had experienced. And like I said, I don't have the sort of extreme that people think about.
Hmm.
My mania was to do with like shopping. I would get a high from going shopping.
Hmm.
And it wasn't that I had thousands of dollars or whatever to spend, because I didn't.
Yeah.
So
Right.
luckily, I don't think, but I know I spent,
Mhm.
I would just spend, and I would get a high out
Yes.
of that. And then I would rationalize it
Right.
because then I'm buying it for somebody else, like if I'm buying from
Hmm.
the kids or for hobby or whatever, I'm
Hmm.
rationalizing it, right?
Hmm.
Um, and then I had some other mania that were a little bit I found scary. I won't go into detail, but one of them in particular, um, after a few days, I can't remember how many days, I couldn't remember all the details. And I was even speaking to a friend just recently who was around at the time,
Mm-hmm.
and she was telling me, "Yeah, you did this and you this happened." I was like, "Well, I have no recollection," and that was the worst. And that kind of, I didn't know what was happening, but I'll tell you, just before the chain of events, I remember coming downstairs because I was staying at a friend's at the time. We had gone, it was her daughter's baptism. We had gone to spend some time with her. And I
Mm-hmm.
remember feeling that heightened excitement at the
Yes.
time. And, that chain of events happened. Um, but I couldn't remember. I could not remember. And that kind of scared me. And although I didn't know what was happening, I said to my friend at the time, 'cause, she said to me, it was like you were demon possessed.
Mm.
Um, and that was how she was like, she didn't understand
Yes.
what is going on.
You were
uh,
not acting like yourself, and you were.
no, no,
Yes.
no.
Yes.
And so the behavior was very extreme, so behavior
Yes.
that I wouldn't
Right. Right.
um, the sort of
Normally
rational
do.
me, yeah, the rational me would
There you
just
go.
wouldn't.
Yes. Yes.
um so I had I've had so few. That was the most extreme one that really, but I've had all the kind of stuff. And it's interesting because when it's happening, all rational goes out the window.
That's right.
So you sometimes, well, why did you do that? You can't really explain. And I
Right.
look back and I think, what in the world?
Right.
And
Because at the time, it's feeling like this is what I've got to
yeah,
do.
this it was very practical. Like, yeah,
Mhm.
I even remember calling a friend and talking to them about this thing in the moment.
Yeah.
I was like, what? Why? What? So that happened, and that happened about. See, my son is 23, around 22 years ago, 23,
Wow.
20, maybe around 20, 19, 20 years ago.
Hmm.
But that really terrified me. Um,
I have a
so
question for you.
mm,
Did you know were there any changes that you noticed after the birth of the kids? Did pregnancy impact it in any way that you can remember?
well, with my oldest, I had postnatal depression,
Hmm.
um, and which was like, and again that was very interesting, because it was different to anything I'd experienced before. It was mainly, it was depression, right down.
Yes. Yes.
Um, I didn't, interestingly, I don't remember having mania
Hmm.
while I was pregnant.
Hmm.
Um, yeah,
Hormones.
and then
Hormones. Just.
with my son, because I had postnatal depression,
Hmm.
and I had gone back to work, after 3 months, I
Hmm.
decided to stay home because I
Hmm.
thought I didn't want to get postnatal depression again.
Yes.
Um,
Yes.
but I still, I still had it, but it took a longer time, or for me to realize, hey, mm, things are not so great.
Yes.
Um, so yeah, that kind of happened. Um, but the chaotic thoughts
Hmm.
was constant throughout my life.
Yeah. I wanna ask you something.
Mhm,
There's a big risk for sufferers of bipolar disorder, which is called behavioral disengagement,
mhm,
where the person kind of gives up. Yeah, they blame themselves a lot for things, right, that happened, and adversities. They give up.
mhm,
Um, is that making sense to you as I say that?
mhm. Yes, because it's. I mean, I think certainly when I was younger,
Hmm.
you know, I just used to fantasize about running away and just
Mm.
creating this whole new narrative for my life, and
Right,
perhaps that would, I had this alter. I had this thing that my parents were some amazing rich people that were going to come
right,
and take me away,
right.
and I was going to. I created lots of fairy tale
Escaping
stories.
your reality, almost
Yes,
escaping yourself. Yeah.
yes. So I would just sit and daydream about that.
Yes.
You know, but as I got older, and I want to talk about the role that faith played in that
Mm,
journey,
mm-hmm.
because I know it's a two-way thing, that faith can actually be an instigator in some ways to
Yes.
bring on certain mental health, ill health conditions.
Mm.
Um,
I'm
but
interested to hear that. Tell me more about that.
well, I think I can't remember exactly when the study was done, um, but it was somebody who did some study and it found that, but it was two things, which is interesting. Found that actually people who were deeply religious,
High religiosity. Okay, that makes
yeah,
sense. Okay.
yeah,
Yeah.
would often be more prone to
They
mental
go,
ill health,
yes.
but
So
also,
the going off, so the so there's a disconnection between real life and reality,
mhm,
right? That's a psychosis piece. That
yeah,
is very similar sometimes to religion. People who are deeply religious can do that a lot. There's disconnection from real life. I'm
yes,
a child of the king. There's also that bit of a specialness too. I'm a
yes,
child of the
yes,
king.
yeah.
Yeah,
Yeah, and the hyper focus, so you
absolutely,
this is the way, right? You've got
absolutely.
this. This
Yes,
is how I must live. So
right.
it can be, but on the
And it
flip
can
side,
become very, very, very routinized and strict too.
yes,
Yeah,
yeah,
it gives a
yeah,
lot of room for a lot of these. Yeah.
yeah. But on the flip side, there was somebody who worked as a chaplain, I think, in a mental health hospital, and he
Hmm.
actually found that actually the patients who were Christians, on the flip side,
Right.
also somehow fared better
Yes.
than those who were not,
Yes.
um, which is
Because
interesting.
faith, yes, spirituality is a protective factor.
Yes.
Spirituality and belief in God, belief in a higher power who can help me in my suffering is
Mm.
also a protective factor, especially for people of color or that African
Yes.
people.
Yeah. And I think for me personally, because I remember whenever I would go to the doctor for my appointments, they would always ask you if you have any suicidal thoughts. That's part of the
Mhm.
routine things.
Right.
And when I would say no, the times when I would say no, or when I would say yes,
Hmm.
they would say, "What prevented you from
Yes.
doing that?" And
Okay.
I
So
would always
before you
answer,
So before you even go further,
uh,
I need you to tell people a little bit more about what that feels like.
what the
Suicidal
suicidal
thoughts.
thoughts.
Yeah, what is
Right,
that like?
right. So a lot of people think that you don't want to you don't want to live,
Hmm.
right? But it's actually you're tired.
Exhaustion.
Yes,
Exhaustion.
you just want to rest,
Exhaustion. Yeah.
right? You want everything to stop. You
Yeah.
want the chaos that's happening in your head. You want
Hmm.
it to stop,
Yes.
and it's not so much of you wanting to die.
Hmm.
Um, Right. Well, for me personally, I think let me speak from my own experience. I don't think it's so much that you want to die. It feels that way because that's how it's
Hmm.
expressed. Because how do you rest
Yes.
from chaotic thoughts when you don't know what's
Right.
happening and you don't quite understand what is happening to me?
Hmm.
You know, it's just you just want everything to stop. You want all the pain to stop.
It's exhausting. It's a lot of work.
Yes,
A lot of emotional energy is
it is.
expended trying
Yes.
to get calm, trying to get stability. Yeah. To
Mm-hmm.
get
Mm-hmm.
yeah. Yes.
Yeah, and I don't think people realize that. And
Yeah.
I know that for me, 2016. you know, crashing a little bit then. I was just
Mhm.
exhausted. I was just exhausted.
Yeah.
I
Yeah.
wasn't sleeping. And I was having lots of unexplained illnesses that didn't make sense. I was hospitalized for days
Mhm.
because in the middle of the night, I just started shaking
Mm.
and babbling. And
Mhm.
it
Mhm.
was scary.
Yes.
The ambulance came and they did all the tests and stuff. I couldn't drive for a while because we weren't sure if I had a seizure. They did
Mhm.
all the tests and there was nothing. And I
Mhm.
remember looking at the doctor and I just thought, let me just ask her this. I said,
Yes.
could this be explained? Could this be because of a mental ill health?
Mhm.
And she said, do you think? that's what it is. And I said, yeah, I think so, because I know that my body was just exhausted
Right.
from the mental energy
Assault. It was a
of,
mental
yeah,
mental
of
assault.
keeping up this front,
Assault.
because I'm going out to church, right?
Right.
You know, I'm in ministry
Right.
and I'm
Preaching.
doing stuff. Yeah.
Mhm.
And inside I'm going, "Arr!"
Yes.
But I have to keep this,
The
um,
mask. The
yeah,
mask. Come on.
yeah.
Yeah.
And
Mhm.
I just got tired of wearing the mask.
Yeah.
I really just got tired, um, of wearing the mask. Did I
Well,
finish
let's
talking
talk
about
about
the
coping. Go
suicide?
ahead.
Sorry.
Oh, you can tell me more if there's more about the
No, no, I
suicide.
wasn't sure if I had.
You did a good job. Yeah, you did
Okay,
a
okay, good. Keep me on track, Doc. Keep me on track.
um um yes, I think I want to keep talking about this because when people say suicide, people are like, oh, it's so far removed, you know, but it really isn't. And
Hmm.
were there actual thoughts, or were they like, I'm tired, I just want to rest? Because sometimes it's like that.
There were
Sometimes
actually, there
I know
were
what to
actual,
do.
yeah, there were, yeah, they were both. They were both at different times.
Hmm. Hmm.
Certainly, when I had that major breakdown in 2010 or whenever it was,
Hmm. Yes.
I didn't. So it happened around October, September, and
Hmm.
I didn't go back to work until I think March the next year.
Yes.
So
Yes.
I was out for a while. I couldn't go
Yes.
out. I just found I would get panic attacks being out
Hmm.
about with people.
What did that feel like? Because people say that word
Scary.
a lot.
It's
Scary.
scary.
So in
It's
your
scary.
body, what did it feel like?
Yes, because this anxiety is really
Hmm.
really strong, and it's
Hmm.
hair and shoulders, head,
Yes.
um, and people will say again flipping, oh, she's having a panic attack,
Hmm.
and it's scary. A panic attack is
Yes.
scary. You think you're gonna
Absolutely.
die.
That's what it
Yeah,
is. It
yeah,
feels in the moment like you're dying.
yeah. You're
Yes.
like you're having a heart attack, right?
Yes. And sometimes
Um,
your heart is beating that fast
yeah,
too.
yeah,
Then
yeah.
yes.
And
Yes.
I remember I was in the train and I was sitting there and I was just talking, I felt, luckily a friend was with me and I was like, I need to get off this train. I need to get off this
Yes.
train.
Yes.
So we came up for the next spot and I was just in a
Yes.
state and she had to call the ambulance and stuff.
Yes.
Um, but, so I couldn't be out in public. I couldn't talk on the phone. And you talked about babbling
Hmm.
as well. And
Yes.
I was at work, I worked in an after school club. I was managing an
Hmm.
after school club. And I
Hmm.
was at work and I just started behaving strange. And I was just,
What
and
did they tell you? What did they tell you? What was the strange behaving that they told you about later?
well, I started feeling a bit weird. And the one of the ladies who worked with me, well, she thought I was having a stroke. She said, Ramona, look at me.
Hmm.
And I couldn't really focus. And I was
Yes.
trying to talk to her and I couldn't,
Hmm.
like my words weren't
Concentration and
forming.
focus again. Hmm.
Yeah, the
Hmm.
words weren't forming.
Yes.
Um, and it didn't last long. That's the scary thing. It didn't last long.
Hmm.
You know, um, I'm not sure how long, but I was out of it for a few minutes. But
Hmm.
I knew that I needed to seek help because I knew that something was going on for a
Yes.
long time.
Yes.
Right?
Yes.
I had this sense that I was going to die.
Hmm.
I had
It's
this
a
sense
fear
of
of it's
dread.
called impending doom. It's fear of
Yes,
impending doom. Something horrible
yes.
is going to happen. Yeah.
Hmm. Hmm.
Very anxiety related.
Yeah,
Yes. Yes.
and it was just it's horrible. It
Yes.
really is. It is
Mm.
horrible. So I didn't go anywhere. I couldn't. I stayed in bed. I don't
Yes.
remember a lot of that time, and I tried to talk to my ex about it,
Hmm.
um, and I look back sometimes. I feel guilty, and I think, how did the kids manage? Because I don't
Mm.
remember anything.
Hmm. Hmm.
Most of
Hmm.
that time.
Yes.
I remember when I started to feel better because a friend called me on the phone and she said, a very good friend, she said,
Yes.
you sound better. You
You were
sound,
sounding more like yourself.
yes.
Yes. Yes. Yes.
Um, so, people who were close to me could tell
Yes.
that there was something wrong.
Well, I want to talk with you about coping and getting better. Before I do that, there are a couple other symptoms like rumination, which is where you say something happens and you felt anxious about it. There are many people who suffer from bipolarity, who will just keep thinking about it. How could I have done it differently? What did I do? What's wrong with me? Da, 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 da. There's also something called catastrophizing, where you look, where it's just, oh, this is horrible.
Mm.
This is just the worst. How could I have done this? Yeah. What's
Mhm.
wrong with me? Yeah.
Yeah,
That
yeah,
these sound familiar.
yeah. And you go over it and you just create all the different scenarios. Okay, I could have done this. I should have done this. Why didn't you do this? You're so silly, Ramon. Why did you do that?
Right.
And all the all the people in my head,
Mhm.
um, they all have their, they have conversations, and I'm like,
Yeah.
it's weird because it's like I'm there. I'm like, okay, you guys need to shut up now.
These are the roommates. So, the Untethered Soul, Michael Singer,
Yes,
that
yeah.
book teaches how to be with those voices essentially in our
Yes,
head.
sometimes I just listen. I just sit and listen to them,
Yeah.
and then sometimes when it's really chaotic, it's just too much. I'm like, okay,
Yes.
shut up. You all need
Shut
to
it
shut
up.
up.
Yeah. Go sit. Go have a seat. Yeah.
Yes, just chill.
Yeah. Well, you're sounding well. Tell us about coping and getting better and managing your health. I mean, how do you come back into a stable place where you can go about your business, do your work, do your life?
Well, I'm on medication,
Mm-hmm.
which has been really really helpful
Yes.
for me.
Yes.
I know a lot of people don't believe in medication, and that's okay. So I'm on a mood stabilizer, just
Yes.
help stabilize my mood so I don't go to mania or crash, which is
You don't
what my life
do
was.
this. Yes.
Yeah, yeah. It's exhausting.
Too much.
So I'm on that. I've been on that since yeah, 2017.
Mm-hmm.
Um, and my sleep my sleep patterns is still a little bit out of whack, but I don't know. I was thinking about this. I'm not sure if it's menopausal, because
Yes.
I'm in the menopause, or I don't know how it
Right.
works. So
Mm-hmm.
the when they coincide, I
Incident.
don't know. Yeah.
Mm-hmm. Mm-hmm. Mm-hmm.
But so I'm on medication, and I've learned to recognize my symptoms.
Yes.
Um, Lack of sleep is a main trigger for me.
Mm-hmm.
If I'm tired, that's just a recipe for disaster.
Yes.
So I need at least 10 hours. I know people think it's crazy, but I do need about 10 hours of sleep. Anything less than that, if I have consistently no sleep, I know that it's not good.
Yes.
So I try to sleep. But the flip side is that I don't sleep well, but the
Mm.
medication really helps me
Yes.
sleep. So that has helped a
Yes.
lot in the last 2 years to help
Yes.
me to sleep. So if I don't take it, I don't sleep.
Yes.
Um, so I'm on that medication.
Mm-hmm.
And because I've learned to recognize my triggers,
Mm-hmm.
lack of sleep, if I'm really tired and so on, um, then I can sort of manage and make sure that I'm not putting myself in a situation where I'm going to crash. And
Yes.
even if I do, then I say, okay, so the next 2 days is going to be hard. So I
Mm-hmm.
try to find different ways of dealing with it. So beach therapy is my thing, right? When I was in the UK, going to the
Yes.
beach, winter, whatever, I find a beach to go and walk along,
Yes.
wrap up warm, and
Mm-hmm.
get out there. My creativity is really what I think helped me most in the last few years. Just
Mm.
getting into painting and just doing
Yes.
um, um, art.
Yeah.
That really, really helped me. Journaling, again, helped me a lot.
Mm-hmm.
Um, and making sure I reward myself
Mm.
with nice things. I know, and I have to be careful with that one because then it can, if I'm, it depending on what's happening. Can you hear the rain?
I can.
You can hear the rain?
I can hear some. Yeah. I can
Okay.
hear it.
Depending on what's happening in my life, I have to be really careful with the
Right.
shopping thing, with treating
Yes.
myself. So what I do over the years, I've learned to shop without spending money.
Yes.
Um,
So do you go to like thrift stores?
no, I with my eyes.
Ah,
So
yes,
I go
yeah,
around the shop and I try
yes,
things on and I look at them and I it has to be very deliberate where I
yes,
say, you're not spending anything today,
yes.
right? So I'll go and I'll look at it and so on.
Mhm.
If I do buy something, I will try it on and I have no problems taking it back the next day. I'll
Yeah,
return it,
yeah.
whatever. And say, in the next day, I say, no, Ramon, you don't really need this, and I'll
Mhm,
take it back.
mhm.
Um, but I do that. I'll go. But if I'm in mania, I avoid going to the shops unless I have to go to the supermarket to buy something. I'll avoid going to TK Maxx,
So,
right? Or
so
even the
wait.
char- or even the charity mall, or TJ Maxx as they call it in the US, right?
So
I
Catholics
avoid.
say you avoid occasions for sin.
Yes, absolutely, absolutely, absolutely.
Mhm,
And even the charity shops, because what can happen is that you can rationalize, right? So
mhm.
I could go into some charity shop and I'll say, thrift store. I say, well, it's only £3, and
Yes,
I'm giving to charity. You can rationalize the stuff,
mhm.
but it's still money that you're spending, whether it's
Absolutely.
£3 or 30 pounds or £300. It's still money.
Yes. And it becomes a
So
problem if it ends up hurting you.
exactly.
Mhm.
So I try to be just aware of that. But the
Yes,
other thing is, I try to still the voice. I try not to beat myself up too much about
yes,
a bad decision that I've made. So I'll say, okay,
yes,
Ramona, you did this today. It's done. You can't do anything about it. Let's try again tomorrow.
yes,
Because
yes.
the old me would stay in that place, and
In
for
the
the next
place
few
of
days I'm beating
self-blame.
myself up. But
Yeah,
it doesn't change the behavior because I will
that's
still
it.
then go and do it.
Another
You see?
time. Yes,
Yeah.
yes.
So what I'm trying to do is change the behavior
Hmm.
by talking to myself,
Yes,
and give myself alternatives, and trying to become a little bit more rational
yes,
about it,
yes,
while at the same, because sometimes you just want to treat yourself,
yes,
and
yes.
it's okay. It's
Hmm.
okay. I give myself grace periods,
Yes,
and I give myself grieving periods as well, right?
yes,
So if
yes,
if there's a time where I'm really feeling down and I've been tired and whatever, I know I'm tired, I will say, okay, today we're having a bed day, and that's
yes,
okay. We're
yes.
having a bed day today. We're not
Mhm.
we're not showering today. It's okay. Nobody
Yes,
nobody ever
yes.
dies because they didn't shower.
That's right. That's
Right?
right.
And so I
That's
will
right.
give myself grace to grieve or whatever,
Hmm.
to have that down day,
Yes,
and then say, okay, tomorrow. Sometimes I might give myself 2 days, 3 days,
yes, yes.
and then say, okay, tomorrow we'll try again. Because
When is your cutoff? When is your cutoff so you don't go into illness?
3 days,
Okay.
3 days, because
Yes.
yeah, any longer than that, then I know I'm in a bad place. Once I
Hmm.
go past day 3 and I haven't showered,
Hmm.
I know
Hmm.
that it's bad.
Yes, yes,
Because
yes.
I think 3 days you can pull yourself back. Well, for me anyway.
Hmm.
Um, but yeah, once it goes past day 3, that's okay, Ramona. You haven't showered. It's day 5 and you haven't showered. Yes.
You
Uh,
know, all of these are strategies
mm,
that clearly you learn the hard way through
yeah.
pain, and things not working. I have a list of coping strategies for
Mm,
bipolar disorder and bipolar psychosis, and you mentioned practically all of them. One of them is monitoring your symptoms. So you're keeping track of your own self to see where you are. There are actually some mood trackers or journals that people can use
yeah.
help them find social support. You talked about your friend that's like your
Yeah.
sister ever who knows, somebody who you can pour your heart out to. Yeah. Marcia calls that your get naked crew.
Yeah, I have a group of those. Yeah.
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 And they're amazing.
Another one you mentioned is triggers. For some people, that's alcohol and caffeine and stuff like that. Avoid triggers. What are you have you identified your triggers up to this point?
So it's interesting because I don't know that, because the doctors asked me that too.
Mm-hmm.
And I don't know that I have those triggers.
Mm-hmm.
I know that I have the triggers for when I'm going down.
Mm-hmm.
So if I don't have sleep, if I'm tired,
Yes.
that. But I don't I don't have triggers that I've identified for the mania, which
For the
is
mania.
interesting.
That's interesting, right?
Yeah,
That's
yeah.
very
Because
interesting.
it happens just randomly. I'll be sitting there and it just happens, and I don't
Like you
know.
said, when you were a kid, you would start
Yeah,
feeling,
it
of
just yeah.
excitement upon you.
Yeah, yeah. But
Yes,
what I
ma'am.
do is
Go ahead.
now when I feel it,
Mm-hmm.
I can say, okay, it's a warning to me to pay
Yes.
attention.
Yes.
Yeah,
Okay. Another one is care for yourself. Make sure you're getting enough sleep, eating a balanced diet, getting regular physical activity.
yeah. I did a lot of walking in COVID.
Yes. And then finally, stick to your treatment. Follow your doctor's instructions and take your medications as prescribed. Any final thoughts?
Sometimes
What would you say to a family? What would you say to a person who's feeling what I described tonight, what you described tonight, or somebody who you have a family member? What are you saying to our people, especially?
I would say it's okay. I know that sounds wrong because we want to be better, whatever that
Right,
means.
right.
And I would say it's okay because you have to start there with saying it's okay, because if you're constantly thinking I shouldn't be feeling this way, there's something wrong with me, it doesn't really necessarily mean that you're going to get help,
That's right.
right? Because that induces shame, and you talk about hiding. Whereas if
Yes.
I say this is okay, then I can
Hmm.
talk to somebody about it.
Yes.
And so I would say start there. It's okay.
Hmm.
It's okay.
Hmm.
And find someone to talk to. Or if you feel you're not at that point where you can talk to somebody,
Hmm.
write out how you're feeling and
Right.
get the thoughts out of your head onto paper. And I
Hmm.
found that really, really helpful for me
Hmm.
because, especially with like nights, and I'm just, my thoughts are racing, I
Yes.
just sit and write. There's a name for that kind of writing exercise. I can't remember what it's called, where you just get
Logo
a blank
therapy,
page.
maybe?
Sorry?
Logo therapy?
Probably you just get a blank page and you write. You don't
Use free
judge it.
writing, free association
Free
writing,
writing
or
or something like
yes,
that.
yes,
You don't judge it. You just
yes,
write it, whatever comes, and
yes.
until
Free
you stop.
association. Hmm.
Yes.
Hmm.
I would say do that. Don't judge it. Don't correct the mistakes. Don't correct the
Hmm.
grammar.
Hmm.
Just write.
Hmm.
And maybe and leave it. Don't read it
Yeah,
over. You
yeah.
might go back to the next and read it over and see, okay, what does that invoke in me? What emotions, what feelings do
Hmm.
those evoke in me? How do I feel about what I've written?
Kind of like a dump, like a mental dump.
Yes, a dump. Yeah, yeah.
Hmm.
Because you might not feel ready to talk to somebody, and if you don't find the right person to talk to, that can
Yes,
be very damaging as
yes,
well. You
yes.
know. So I would say start there, and when you feel ready,
Hmm.
go to see a mental health professional because you may not feel
Yes.
ready. You're not,
Hmm.
you know, and I think you have to be kind to yourself
Hmm.
if you're not feeling ready. You know,
Hmm.
you like, I can't really talk to people about this. It's okay. It's
Yes,
okay.
yes.
Just
It
keep
makes
saying that.
sense. That makes sense. Yeah, that
Yes.
makes sense
Yeah.
that it's hard to talk about it.
Yeah.
Yes.
Absolutely.
Yeah.
Um, and to family, I would say we have to be careful the words that we use around people, the things that we say. I really hate it when people dismiss people as bipolar. When somebody's
Mhm.
having a bad day and they say, "Oh, here she's go, she's just bipolar." I'm like, what does that
Right,
mean? Do you really understand what bipolar is? If you
right.
knew, and there are different, there are different types of bipolar. You
Mhm.
know, it's not
Absolutely.
like one
Absolutely.
strand.
Yes.
Um,
Yes.
so I would say let's be careful how we talk to people, how we talk with
Mhm.
people,
Mhm.
and how we talk to ourselves as well, because I think it starts there. Um, and let's talk about these kind of things
Let
more,
us.
because it allows people to feel able.
real and human.
Yeah. Yes. I mean, I spent so much of my life hiding
Mhm. Yes.
the shame that I felt because of what was happening internally, and I couldn't tell
Right.
anybody. And even the first time talking, and people, I remember somebody said, what have you got to be worried about? What's happening? What's happening in your
It's
life? And
purpose is
are
in
you
you.
praying enough? Are you reading
Okay.
your Bible? Yes, yes.
Yeah. That's
um,
something I really want all people to work on. That piece about you're not praying enough, you
yeah,
know, did you
yeah.
give it to God? Of course, I gave it to God before I even came to you.
Yeah,
You know, like,
absolutely. Like, what do you think I was doing? You
yeah,
know? Yeah.
yeah,
And somebody said to me, "You don't have bipolar." I'm like, "Okay, you like, yes, you got a degree in nothing, so okay."
right, right,
Um,
right.
and but yeah, just let's have conversation. Let's have safe spaces for people to
Mhm.
talk. And let's. I think I really want us to talk about how we prevent certain things, because we talk
Mhm.
about resilience a lot, right?
Mhm.
Being resilient and so on, and it's bandied about.
Right.
I want to say, how about we create situations that people don't need
To
resilience,
recover from.
and what are we doing to
Right.
create a world where I don't need to be resilient?
No, you know,
Like, it's like you say, it's a badge of honor being resilient. Well,
no,
I'm
no.
just tired of being resilient.
And the thing is, there are resources available to make my life easier, to make this
Absolutely.
experience, the quality of my life, better, enjoyable, fun, something I can look forward to in the morning versus lugging myself out of bed. It's
Absolutely. Take
yeah.
the medication, for goodness sake. Go to therapy. Don't walk around on a broken leg, Yeah, there's a dog that I keep was passing by in the neighborhood that I so want to take to the vet. And it
Mhm,
belongs to a family. I thought it was an abandoned dog. And it's got a broken leg. And every time
mhm.
I see it, it looks worse because nobody's taking care of it.
Yes.
The people who owns it are just sitting around. They don't
Yeah.
care about this dog, or they don't
They
have the
think it'll be
resources.
okay. They think it'll be okay.
Yeah, and it's just a
Not
dog,
kill it.
so it doesn't
Yeah.
matter. So
Yeah.
let's not be like that dog limping through, and let's not be like the owners of that dog watching our family members limping through life and
Mhm,
not do anything
mhm.
about it. Sorry, I'm wearing sunglasses because my glasses broke, and these are prescription sunglasses. I wanted to read what somebody
Okay.
wrote.
Yes, she wants to, Fearless is asking, how do we identify bipolar in a person? Ramona's going to give you some symptoms, but I'm going to invite you, Fearless, to really listen from the beginning to the
Mm.
end. It's broken down. You won't miss a thing. Okay, but Ramona has a personal experience with
Yeah, well,
the
I would say listen to what Doc said, because my thing might be very different to somebody else. But recognizing change in behavior,
Mhm.
somebody who seems to be what we call in Dominica OSHA.
Yes,
Okay,
yes,
the
yes.
OSHA, they're always excited. They're always running all over the place.
Apache,
Yeah,
yeah.
and they can't keep
It's Apache
still.
in everything. Yeah, yeah,
Yeah,
yeah.
yeah, yeah. And they can't focus on one thing. I mean, it could be
Mhm.
other reasons,
Yeah.
like ADHD or whatever,
Mhm.
which also I'm exploring for me personally, because
Yes, which
apparently
is
there's a
possible.
link. There's a
There is
link.
comorbidity, it's called, where
Yeah,
often you
yeah,
can have both. Yes.
yeah.
Mhm.
So look for change in behavior, especially. I think, and Doc, correct me if I'm wrong. I think it's around. They say when bipolar begins to manifest, most time it will begin to manifest when you're around 13, 14, around that
Early
age.
teens. Yes,
Yeah.
yes, yes, yes. Mid
So
teens,
yeah,
mid teens. Yeah.
yeah. So just
Mhm.
keep an eye on the young people around you and look for the change in behavior.
Mhm.
Um, and if they say something that you think is a bit strange or whatever, just ask them a little bit about it. Ask some probing questions,
Yes.
and get them talking about it. And listen, don't judge, and don't diagnose either, because I
Mhm.
think we need to be careful about diagnosing people with conditions that are serious health
Right.
conditions.
Right.
Um,
You know, something
yeah.
you just said about the age that it starts to show itself. Often many of these people will, when they were younger, have been diagnosed with an attention disorder and
Mm.
focus problems. Yeah, they're not paying attention in class when they're a little bit, and we don't realize that sometimes they have some of these things already kind of bubbling
Yeah.
up. No,
Can do
yeah.
better. Look for those things. Can do better. That
Mhm,
was
mhm.
mine. They
Yeah.
let me stay down in second form because they said I could do better. They wanted to get me to get better grades. Yeah, in
Wow.
second PSS. Yeah.
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 Yeah. Well, I want to say thank you, Ramona.
No problem.
Appreciate you sharing your story. Y'all, this is real life. We're not exempt, we're not immune. That's why we want to know what to look for so that we know what to do with what we see. Okay. My biggest encouragement to you, please do not be afraid of medication. The same way you're not afraid of hypertension medication and diabetes medication, there are some mental health illnesses that will typically only get better with medication support as the basis of treatment. Okay. And yes,
And
therapy. Yes, Ramona.
there's a risk of death.
Look, listen. When you're experiencing such shifts in mood, something ironic with bipolar disorder is you have the mania where I can do anything. I want to do 50 things. I can do all that. Yes, I'm a child of God, right? I, I have special powers. And then you go
The
down
crash is the
to
worst.
crash to where I can't do anything. I'm exhausted. I'm tired. I don't want to get up in the bed, right? Many people, as they're coming back up, from the depression, right when they get the point where they have enough energy, that's where a lot of people hurt themselves bad because they're not just like that anymore on the bed in
Mm.
depression, coming back up and getting energized, but they're not yet high enough.
Yeah. Yeah.
So this is life threatening.
It is.
It is life threatening. And so we have to take just pay attention to yourself, to your family. Look at your kids if they're struggling with attention and focus problems when they're little, they're at higher risk. If there's anybody in your family who has a history of any mental health challenge, they're at higher risk. Remembering again for us in the Caribbean, I don't know if my mom or my dad had mental health challenges, but kind of look at their lives and see did something seem to be a little bit off with them? Were they drinking too much? Right? Did they have many kids all over the place? Those kinds of things are little signals because it's not usual. It's not typical behavior. Okay? So you kind of keep an eye out for yourself and for your kids. Okay?
Yeah. Yeah.
Yeah. I want to thank you all for joining us. We'll end with Jacqueline's offering to you, Ramona, tonight. Thank you for sharing with us.
Okay.
Nellis and Jacqueline and Franklin and Joe, everybody who tuned in tonight, Karen, Vendetta, Simone, Matilda, Elvon, y'all, thank you all for listening. Take care of yourselves and your families. Okay? We're worth it.
Yeah.
Peace.
Thanks, Doc.
You're welcome, Ramona.